Living well. Living well really is the aim of any of the human being in our life, starting from any child patient to any other to growing patients. So what we'll try to do in our program is to give you the medical information in a very light meal and in a very simple way and language. We'll try to discuss about diseases, the causes of the diseases, the symptom of any disease, and then we'll finish by trying to treat or suggest any treatment for those diseases. So the aim of Living Well is not only yours, it's also our aim in our program to give you a very light meal of medical information in a very simple language. Hi there. We all know that the total human body actually will be controlled through a number of hormones. And these hormones actually will be produced by a number of glands, let's say. For example, the thyroid gland or the adrenal gland. Today I will talk about one of the diseases which is, I will not say it's a common disease, actually it's one of the rare diseases, which is called Addison disease. The Addison disease, it is what we call it the adrenal insufficiency. Let me just give you a brief, let's say, or some information, or to tackle some information about the adrenal gland. The adrenal gland, actually, it is the gland that is responsible for the production of some of the hormone, and most of them is the cortisol and the aldosterone. Both the cortisol and the aldosterone will control the blood pressure along with other vital, let's say, function in inside the human body, along or starting from the kidney function all the way to the blood vessel and the heart even. So these hormones usually will be produced by what we call it the adrenal gland, which is the gland situated just above the kidney. When these glands, for example, will work in a very low quantity, let's say, or they decrease in function, this is what we call it adrenal gland insufficiency. So in a brief, Addison disease, it is adrenal gland insufficiency where the hormones, which is the aldosterone and the cortisol, which is produced by the suprarenal gland or the adrenal gland, will be less in quantity inside the human body. We all know that these two hormones will control a number of very vital functions inside the human body, and from that point of view, the symptom of those, let's say, insufficiency or the adrenal insufficiency or Addison disease, the symptom will depend on the hormonal level rather than any other complication. So what are the symptoms of Addison disease? Actually, the first symptom that usually those patients will have fatigability, or they will become very easy fatigability. Another thing which is hypotension, decrease in the blood pressure. Along with hypotension, they will have a decreased level of blood sugar even inside the human body. Along all of these symptoms, they will have nausea, abdominal cramps, even sometimes vomiting, sometimes muscle cramps and twitching. Well, actually, even those patients will have what we call the salt craving. They will like to, let's say, eat more salt, or they like to have more salt even inside their let's say, meals. Another thing, even they will affect what we call it the psychological side of the human personality. Most of those patients with Addison, they will have what we call it a mild to moderate symptom of depression. They will be depressed, socially isolated. They will not have the tendency, let's say, to gather with other people. Another thing which is also very important, and most of those patients will notice it, that they will have what we call it dark skin or darkness of the skin. The color of the skin will be, let's say, changed, and it will be more darker compared with their skin color, let's say, previous to having that disease. And most of the time we'll just ask the patient to show us an old photo of him, and then he will be let's say, surprised by the change in the color from a light color skin to a dark color skin. So hypotension, hypoglycemia, nausea, vomiting, muscle cramps, abdominal pain, darkness of the skin, along with other symptoms like depression, all of these represent the early sign and symptom of Addison disease. So when it is important to seek a medical advice? One of the first important factors that if you have all of these symptoms that I've already mentioned with more severe form, or sometimes it might be associated with very severe symptom of hypotension, for example, or even hyperkalemia, a very high level of potassium, it is important to seek a medical advice. Along with abdominal pain that usually it will not relieved by a simple analgesia, with salt craving, even depression and hypoglycemia. All of these are the symptoms where as a patient you need to seek a medical advice. It is important to seek a medical advice of a specialized, let's say, physician, like endocrinologist, for example, that is specialized in Addison, or even any other, let's say, specialty that have a good background about Addison disease. So what are the causes of Addison's disease? Actually, the causes is mainly related to the damage that I've already mentioned, damage to a part of the adrenal gland, which leads to adrenal insufficiency. For example, in some cases, like for example, in cases of tuberculosis, TB infection, usually TB infection as a bacterial infection, it will affect the adrenal gland and it might cause adrenal insufficiency and the damage either to the whole gland or to a part of the gland. Other causes, like for example in cases of a trauma or in cases of any other surgical, let's say, intervention or surgical procedure done to the kidney, and it might affect the adrenal gland. Also, sometimes we might have like a sort of, let's say, thrombosis or decrease in the blood supply to the adrenal gland, which might lead to damage to the whole adrenal or a part of the adrenal gland. So all of these symptoms or all of these, let's say, underlying causes will lead to one final, let's say, result, which is either damage to a part of the adrenal or to the whole adrenal. Glucocorticoids, mineral corticoids, androgens, all of these are very important, let's say, composition of the adrenal gland, with even sometimes the insufficiency might not only cause, let's say, changes in the blood pressure or blood sugar, it might even cause change in the personality of that specific patient.